on 1st July 2022 between 6 and 7 pm to answer all questions on chest diseases.
नमस्कार इश्टानो येवकार आयच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक म्हजो काळजांतान येवकार. आयज जावन आसा जुलायची 1 तारीख आनी आमी नॅशनल डॉक्टर्स डे मनयता. म्हणजे दोतोरांक भेटयल्लो दीस. एक दोतोर आपल्याच्या पेशंटाच्या जिवितांत बारी वावुरता तेका भलायकीच्या मार्गार हाडपाक, तेका बरें जिवीत दिवपाक. आनी आमी देव न्हू, दोतोर केन्नाच देव जावंक शकना, पूण सपोर्टींग एक्टर देवाच्या रोलान एक दोतोर आपल्याच्या पेशंटाच्या जिवितान कोत्ता. तर प्रुडंटाच्या नांवान, म्हज्या आख्ख्या हॅलो दोतोराच्या टिमाच्या नांवान आनी तुमच्या व्ह्युअराच्या नांवान गोंयच्या दर एका दोतोराक हॅपी डॉक्टर्स डे. इश्टानो सदांचे पयलीं तुमकां खबर आसा आयची कार्यावळ फोन इन जावन आसा, आमी लायव्ह हा. तर आमचे फोन नंबर जावन आसा 24904444 आनी 24904445. भलायकी विशीं तुमचे प्रश्न तुमी आमकां विचारूं शकता. त्या भायर आमी लायव्ह आसा फेसबूक आनी युट्यूबाचेर, थंयसरूय तुमी आमकां तुमचे प्रश्न विचारूं येता. आयज म्हज्या सांगाता स्टुडियोन आसा डॉक्टर अनिल मेंढिराता, वास्कोचे फामाद तज्ञ दोतोर, ते चेस्ट स्पेशलिस्ट म्हणजे पुलुमाचे दोतोर. दोतोर डॉक्टर अनिल तुका येवकार आयच्या कार्यावळीन. इश्टारो डॉक्टर अनिलाची घेवया एक ल्हानशी वळख.
डॉक्टर अनिल मेहंदीरत्ता हे नामनेचे सिनियर चेस्ट फिजिशियन. मार्च 2000 वर्सा सावन ते वास्को प्रायव्हेट प्रॅक्टीस करता. एमपीटी हॉस्पिटला खातीर चेस्ट फिजिशियन म्हणून वावुरता. तशेंच ते इंडियन ऑयल, हिंदुस्तान पेट्रोलियम, LIC आनी एअर इंडिया हांच्या पॅनल ऑफ डॉक्टर्सा खातीर नियुक्त आसा. तांणी तांची MBBS आनी MDची पदवी गोवा मेडिकल कॉलेज सावन मेळयिल्ली आसा. 2019 वर्सा तांकां IMAचे बेस्ट स्टेट प्रेसिडेंट अवॉर्ड फावो जाल्लो.
डॉक्टर अनिल परत एकदा येवकार तुका आयच्या कार्यावळीन.
थँक्यू.
डॉक्टर कॉमन अशे चेस्ट डिजीजीस कितें तूं कॉमनली पळयता तुज्या प्रॅक्टिसीन?
Common chest diseases which we see are basically allergic rhinitis, that is allergy of the nose, asthma. Now with the COVID coming into picture, there are a lot of cases of COVID and post-COVID complications, especially after the second wave.
Right.
The second wave of the Delta, which has caused a lot of post-COVID complications, of especially lung fibrosis.
Right.
Other diseases what we are seeing more commonly are chronic bronchitis. These are the few respiratory diseases which are seen very, very commonly. Rare diseases what we see are something called as interstitial lung disease, some pneumonias in the lung, very few cases of collagen vascular disorders of the lung.
Right. Okay. So doctor, allergic rhinitis. What are the causes of allergic rhinitis, and can it lead to further complications in the lung diseases?
Yes, the commonest cause of allergic rhinitis, like it's allergy, is basically the dust which is present in and around the house. Maybe dust mite. These are small insects, which are not seen by naked eye. These dust mites are found in the mattresses, cushions, carpets, cold, damp place. These dust mites, we are not only allergic to dust mite, we are also allergic to the excreta of the dust mite. So when we inhale these dust or dust mite things, even certain insects like cockroaches, very common. Around 40 to 50% of Indians are allergic to cockroaches, either living cockroach, dead cockroach, or any part of the cockroach present at home. Plus the atmospheric pollution which is around us. These are things which are very, very common. And if we don't control allergic rhinitis, which is seen, the study shows that 30 to 40% of these patients, if we don't control allergic rhinitis, the allergy of the nose, they'll end up getting asthma later on in your life. So one should be very particular about controlling allergic rhinitis.
Right. So allergic rhinitis can eventually lead to asthma.
In 30 to 40% of cases.
Right. So doctor, how can asthma be diagnosed? एका पेशंटाक कशें कळटा की आपल्याक अस्थमा आसा म्हणून?
It's very simple. One is the history. Patient येतात आमचे कडेन आणि सांगतात दोतोर खोकली येता, न्हीद पडना, खोकली especially in the night, seasonal variation, with change in the season he gets it. Wheezing. Right. That is, wheezing is what? A whistling sound while breathing. Kuku आवाज येता this. Simple thing to diagnose asthma in any of the clinic is very simple. A instrument called as peak expiratory flow meter, peak flow meter.
Right.
This is thermometer of asthma. This is a peak flow meter. Very simple to use it. One, there's a small meter here. One has to hold it this way, take a deep breath, put this into mouth, blow into it. For a normal female, it is 350 to 450 liters per minute, just single blow. And a male, it is 450 to 550 liters per minute. In children, it is based on the height. Suppose the height of the child is 45 inches, they approximately come into 145 liters per minute. Based on this, we can diagnose asthma. This is very simple, very cheap, just cost around 800 to 1000 rupees. We tell the patient, asthmatic patient, also to buy this at home so that they can monitor their asthma. Based on this instrument, they can increase the dose or decrease the dose. This is cheap, reliable, affordable instrument, portable instrument. Other way of diagnosis is a bit expensive. There's something called as lung function test. So we subject the patient for lung function and after 15 or 20 minutes we repeat the test again after giving a bronchodilation with either arsaline, that is audiolin, and we repeat the test after 15 to 20 minutes. After 15 to 20 minutes, if there's a reversibility, if the thing improves by 20%, that means the person has got asthma and will respond very well to the inhalers.
Right. So, doctor, what are the myths in the treatment of asthma?
The commonest myths in the treatment of asthma, we put the patients on steroid inhalers. One should remember that steroid inhalers contains 100 the dose of a tablet.
Right. Doctor, I'll just interrupt you. We have a call, so we'll take it.
Yeah.
Hello?
Hello?
Yes?
Madam?
Hello?
Madam?
Oh,
Madam?
yes, I can hear you. मास्तर तुमचा प्रश्न पत्तून विचारा. हॅलो.
हॅलो?
होय, ऐकू येता, सांग.
घरात जर झाडू मारलो न्ही
होय.
तर दसऱ्याचे म्हाका शिको येता नॉन स्टॉप शिको
ओके.
आणि तकली चड जाता.
ओके.
हाचेर जे आसा
ओके. हाचेर कितें उपाय जाय तुका?
हे जे उपाय असा, एक तरी तुम्ही पहिले डस्टिंग करता ते ड्राय डस्टिंग करपाक बंद कर, वॅक्यूम यूज करा तुम्ही. सेकंड थिंग, यूज अ वेट मॉप. थर्ड असा, डस्टिंग करपाक जाय तुमकां फ्रेश मास्क घाला डेली. एंड अदर थिंग इज दॅट नाकाचे स्प्रे आसा, एंटी एलर्जीक स्प्रे आसा, ते तुमकां स्टार्ट करचे पडटले. सो प्रिवेंशन इज बेटर दॅन क्युअर. कितले तुम्ही प्रिवेंट करतलो, कितले तुम्ही अवॉइड करतलो, तुमकां तितले फायदो जातलो तुमकां.
म्हणजे अशें दिसता की तिका अलर्जी आसा डस्टाची.
होय, डस्टाची अलर्जी आसा. बेस्ट थिंग इज टू अवॉइड. ते अवॉइड करपाक जाय. अवॉइड करपाक जायना, यू नीड टू टेक द नेझल स्प्रे. नेझल स्प्रे येता ते तुका स्टार्ट करचे पडटले अलर्जीचे. अगेन नेझल स्प्रे आसा तेजे टेक्नीक इम्पॉर्टंट आसा. कशें घेवपाक जाय, कशें क्लीन करपाक जाय, तुका दोतोर कडेन वचून मेळून तुका शिकपाक जाय आनी स्टार्ट करपाक जाय.
Okay. Right. So, doctor, before the call, we were speaking. What are the myths with regards to treatment of asthma?
Yeah. See, the commonest what happens in asthma. Let me tell you what actually happens in asthma.
Right.
When your lungs are full of windpipes. So let's take a cut section of a windpipe. This is a windpipe, normal windpipe. If you see this windpipe, this is the orange layer. Is the outside is the muscle, and there's a cut section here. There is a lumen where the air passes. Understood? So
Right.
this is for the normal person. Now what happens in asthma? It's very important to understand what happens in asthma. You see, this is what is happening in asthma. The muscle has become tightened here. You see this? The whole thing has become spiraled, and if you see the inside part, the lumen has become narrow.
Thick.
It's become thick, it's become red, and the lumen is there very hardly little air going into it. Now
Right.
one should remember that the treatment of asthma is based on this. Normally people what they give is Astalin tablet that they give it, that acts only here. It doesn't act on this part, the red part and the lumen. So where the kunku आवाज येता, तुमका किती kunku आवाज येता, basically because this is touching each other. You take two paper, rub against each other, what happens to that? There's a friction, there's a sound coming. So this thing is where the steroids act. The red part is the steroids, is anti-inflammatory, reduces the inflammation. Now myth is simple, is that you start the patient on steroids, the growth won't be there. That is wrong. In fact, the children, if you put the patient on inhaled steroids, there's a difference between inhaled steroids and tablet steroids. Inhaled steroids contains 100 the dose of a tablet, so hardly 1% reaches the lung. It's like you get an injury on the hand. You are going to apply the ointment. You're not going to eat the ointment. Same way the inhaler acts directly in your lung. So there's no systemic absorption. Even if systemic absorption is there, it has got hardly any side effects. So we tell the patient to put the patient on inhaled steroids, which will act directly here. In fact, the child catches up growth. They say it will affect the pregnancy. No, it doesn't affect the pregnancy. Third, there's a common saying that it affects the fertility of the patient. No, it doesn't affect the fertility of the patient. Very safe, very simple, very easy to use. One puff twice a day. Most of the steroid inhalers are twice a day. Can be taken, and dose has to be adjusted based on the response of the patient. And the patient should be well taught, being monitored simple at home with this peak expiratory flow rate, and dose can be increased or decreased by the patient himself if the technique is taught to the patient. Now, as far as the treatment is concerned, there are different types of modalities, inhaled modalities which are available. The same inhalers are available in different forms. There are various things. This is a dry powder inhaler where we take a capsule, put into it, here, twist it, the person has to inhale it. How to inhale is very simple. He has to raise his chin up. There's some scientific step about it. Empty the lungs out. This goes in the mouth. He takes a deep breath, holds the breath for 10 seconds, leave it from the nose. Very important is holding the breath. If you have to hold the breath to allow the medicine to absorb. Now, same medicines are also available in the same different form. These are different inhalers. Very safe, very easy to use. Shake this inhaler, open the cap up, again raise the chin up, rest of the step remain the same. Empty the lungs out, put in the mouth, take a deep breath, hold the breath for 10 seconds, allow the medicine to get absorbed, leave it from the nose. The newer inhalers, this becomes a problem if the patient has got some arthritis problem. So here you need to press it. This particular inhaler, there's no pressing. You need to just open it, leave the breath out, put this in the mouth, this is mouth actuated. Hold the breath, leave it from the nose. Simple as that. One puff twice a day of these inhalers will definitely help the patient long term. Only side effect of these inhalers are if the person doesn't wash his the inhalers properly, the tip is not washed, they get sore throat. So you can just do a salt water gargling or rinse your mouth with water. That's good enough, very safe, very easy to use. And these inhalers have got absolutely no side effects. So I request all the patients who are asthmatics to visit their chest specialist, choose the right kind of inhaler and be on the inhaler for a long period of time. And if they feel that before a particular season the disease worsens, just increase the dose before the season starts so that they don't have any exacerbation. It is commonly seen, especially in a country like India, the maximum exacerbations are in the night. Most of the patients land up with the exacerbation in the hospital during the night time with the season change, and most of these patients are not on inhalers.
Right.
So these patients are to be put in inhalers. We need to reduce the visit to the hospital. We need to reduce the admission to the hospital. We need to reduce the patient taking oral or injectable steroids.
Right. Doctor, we have a call, so we'll just take that. Hello?
Hello,
yes?
Yes, I just want to know that the doctor, my daughter, when she gets up in the morning, she gets sneezing and cold, she gets like running nose. Why is that so early in the morning? And by 10 o'clock, 10:30, she's okay, normal there.
How old is your daughter?
She's 17.
Are you using AC or something?
No.
Okay, there must be something in your, like I told earlier, there must be something called as,
or some allergen that is
allergen must be there, like dust mite, or you must be using a mosquito repellent like good night, heavy smelling items. There must be something in a mattress or cushion or upholstery. So the best way of killing this dust mite is keeping your mattresses, cushions and upholsteries in the hot sun once in 15 days or 20 days. Just tell someone to beat it up. That helps. And avoid heavy smelling items like repellents and deos and perfumes and dhoop, agarbattis, all those kind of things has to be avoided. If still doesn't control, then she'll then need to take anti-allergic tablets or put a nasal anti. Absolutely nothing. They're very safe. Very safe.
Very safe, not allergic at all.
Yeah.
Fine, doctor.
Thank you.
Yes. So, doctor, what are the different treatments and what is the best treatment for asthma? Like you said, inhalers. Is there anything beyond that?
Yes, inhalers are the best treatment for asthma. We have a guideline called as GINA guidelines. Based on the guidelines, Even in children, inhalers are very safe. There's a small inhaler, we get a baby mask, we can fit the inhaler to the baby mask and take it. Other thing what we can do is something called leukotriene antagonist tablets are there called as Montelicast.
Okay.
These do not act the way the inhalers act, but they don't act in a day or two, but over a period of time, they definitely help. They are coming in pediatric doses, they come in granules now, they come in sachet forms, they come in dispersible tablets. We can start these for small children and can be taken safely.
Right. Doctor, what is occupational asthma? Is there a condition like this?
Yes, occupational asthma is asthma which is seen at the workplace.
Right.
This occupational asthma need not be seen at the workplace also. Very important is that when he asks the person who is working over there whether he gets these attacks only at the workplace or he gets the attack even work away from work, especially on the weekends. Here it becomes very important is to diagnosis. Again, what plays a very important role is, like I told you, is peak expiratory flow rate. We
Right.
give this instrument to the worker, tell him to do this 4 times a day, keep a chart.
Right.
Not only at the work, but he also has to do it at home also.
Right.
Now
Doctor,
one
I'll
should
just
also
interrupt you. We have
Sorry.
a call, so we'll take it. Hello.
Hello,
Yes.
Joseph speaking.
Yeah.
My friends they know the dog, cat, they have done that for infection for the children and children.
Okay.
Yes, if they are allergic to it, definitely will affect them. You need to avoid it. If they are not allergic to it, then one need not avoid it. You can always keep any kind of pets at home. But if you feel like the getting
It's
exposed to
triggering an
the
allergy or it's causing
Yeah,
problems.
problem, then one need to avoid it. It does depends on person to person.
Thank you so much. God bless you.
Thank you.
Right. Thank you. So, doctor, I interrupt you. We were talking about occupational asthma and how
Yes.
to check it in workers.
So we need to give them a peak flow meter where he monitors his peak flow expiratory flow rate
Right.
3 to 4 times a day throughout the week, on the weekend also. Very important in history. We need to see whether the person goes to the workplace and gets it, and whether he had some kind of sneezing problem or some kind of allergy problem like running of the nose or itching of the eyes or skin allergy even prior to joining the work also. So it need not be occupational asthma, it might be the asthma which was earlier there, which must have been suppressed, must have got worsened after getting exposed to the allergen, the trigger factor. Now what is important here is that we need to find out if that workplace the person is getting any wheezing or asthma symptoms or not. If he's getting, the first treatment is that we need to get the person out from there. We need to get him out and relocate him in the company away from that exposure place. The reason is simple, otherwise the compensation comes, the legal problem comes into the picture. It is very difficult to prove that that particular dust must have caused it. It's better to relocate the person within the same company and treat him, the treatment remain the same, the inhalers, and tell him to avoid the exposure to those kind of things by wearing a mask, by keeping the area clean, by using proper ventilation, etc.
Right. Doctor, we have a call, so we'll take that. Hello.
Hello,
होय
ऐकू येता?
होय होय ऐकू येता
माझा एक दुसरा प्रश्न विचारपाचा आहे.
होय विचारा
दोतर म्हजो एक प्रश्न आहा. कोविड जाल्ले मनशाक आनी तेका हार्टा आसलोले तेका इन्हेलर दिवपा जायना तेका पयलीं दिताली.
नाही जाता दिवन जाता. कित्याक दिता पयलें तुमी? कितें दमेचें कितें आशिल्लें, ब्रोंकायटीस आशिल्लें तिका?
ब्रोंकायड आसना तेका पूण तेका बिस्ते बोलयल्ल्या भाशेन दिसताले पूण तोंडांतल्यान कांय भायर सरना तेका भायर सरनासलें. मागीर तेका हॉस्पिटलांत तेका बुराक देखून गायले पूण कांय येवना. आनी मागीर ते कोवीड जालें आनी जायते वर्सांनी मागीर तेका ते भाशेन जावपा लागलें आनी तेका इन्हेलर दितालीं घरा सदांच.
कसलें इन्हेलर? नांव याद आसा? कसलें इन्हेलर?
नेबुलायझर तेका दिवंक ना, दिना काय म्हणून दिवपा जायना म्हणून सांगिल्लें.
ना ना कसलें
Inhaler खंयचो वापरता
कसलें
तुमी?
इन्हेलर, कसलें नेबुलायझर? नाव याद आसा? नाव
नाव
याद
खबर आहा ते इन्हेलराचे?
ना तेका कितें घाताली ते धाकटे इंजेक्शन तितून घाताली.
हां ते नेबुलायझर, ते मशिनां घालून
नेबुलायझर होय.
मशिनां घालून दिवंक जाता, काय प्रॉब्लेम ना तिका, एब्सोल्युटली नो प्रॉब्लेम.
होय होय. थँक्यू डॉक्टर.
ओके, वेलकम.
Thank you. So, doctor, what is the role of monitoring asthma at home, and how does it help the patient?
Yes, monitoring asthma by using the peak expiratory flow meter helps you to manage your asthma by increasing or decreasing the dose. You can titrate the dose yourself.
Right.
Suppose if you feel like you're getting an attack of asthma, which can be seen on this peak expiratory flow rate, just ask the person to blow into it, monitor it, keep a chart. If you feel that it's dropping, increase the dose of inhaled steroid. I'm talking about inhaled steroid, I'm not talking about oral steroid or tablet or injectable steroid. Increase the dose of inhaled steroid prior to the season changes or if he feels like it's going to worsen. For example, there are different zones. In children, we have got a red zone and a green zone. When it is between less than 50% of the desired value, if the patient is red zone, patient has to be taken to the hospital, put on oral steroids or injectable steroids. If it is between 50 and 80%, the patient's relative can themselves monitor the dose, can increase the dose to twice a day, increase the puff is taking, suppose the person is taking 50 micrograms, increase it to 125 micrograms twice a day. If he's taking 125 micrograms, double it to 250 micrograms twice a day for a week or 10 days. Monitor it, the patient is fine, go back to the normal dose. So this slight titration of the dose can be done the patient relative themselves.
Right.
But if the thing is not controlled, one needs to go and consult the doctor. Very important is that do not delay it. If the but if the patient is getting fever, patient is getting yellowish color sputum or greenish color sputum, the wheezing increases, the oxygen saturation drops, then he needs to visit a doctor, start antibiotic or oral steroids.
Right.
So that point should be taken care of at home, where the patient relative should be told, fine, these are the things you should take care of it, where you need to run to the doctor immediately.
Okay. Doctor, we'll take this call. Hello?
Hello?
Yes?
This is regarding my daughter who is asthmatic. She's 9 years old.
Right.
Okay. She gets wheezing and I nebulize her with Duolin.
Okay.
Okay. And I had done an allergic test. So she is allergic to wheat and milk and cocoa. But I have stopped all them also. But nothing has been, there is no effect as such. She still gets wheezing.
Yes.
Right.
So
this is a food allergy related problem.
You have allergy to one item or two items or 50 items, the treatment remains the same. You need to put your daughter on inhaled steroids. Giving nebulizer is like, let me give you an example. There are two types of inhalers. Okay, one is emergency inhaler, one is long-term management. You have two types of account, where you get a debit card, ATM card, where you rush to withdraw cash from your account. You have a fixed deposit, we get more interest in the long term. The steroid inhaler is long term. The other inhaler, what you said just now is Duolin or Rastylane, is a short term. It acts only for 4 to 6 hours and then the bronchospasm goes back. Understood, no? What inhaler you are giving is acting only on this muscle outside. You are taking care of the temporary problem, but you are not taking care of the major problem which is inside. This one. So you need to put your daughter on steroid inhaler, one puff twice a day, depending upon the body weight, etc. You need to start that, and do not worry, do not think that this steroid is going to shunt her growth. In fact, she's going to catch up growth. The repeated attacks of breathlessness which she is getting, like you said, you had to use it in the night, in fact is... Yes, so that is a part of that. The steroid inhalers will definitely help her lung. The more attacks she gets, the more weakened her lungs become. The more you are reducing the chances of catching up the growth, you are delaying the maturity of the child in this case. So you need to start the patient on inhaled steroids. You are taking care only of the temporary solution, you are not thinking of long term.
Okay, doctor. Yeah, thank you so much.
Thank you.
Yes, thank you. Doctor, India is known to have a lot of TB cases.
Yes.
Do you think in the current era, is there a rise in TB in India or in Goa for that matter?
There's not actually a rise in TB right now, but yeah, we do have a lot of cases of TB coming up, where Government of India has started a program called Nikshay and Eradication of Tuberculosis by 2025.
Right.
What has happened is because of COVID, since there was a lot of mass was used.
Backseat.
Yeah, so TB has taken a backseat, and in fact the number of TB cases had reduced. During last year, when I used to see around new TB cases, diagnosis in my clinic was 8 to 10 per month. it had come down to 2 or 3 per month, the new TB cases. Thanks to the mask, that has reduced actually. But yes, TB cases are there in the society. We need to detect them, we need to find them, we need to treat them. And very important now, TB is a notifiable disease. Each and every doctor has to notify
The
a newly detected
health services.
tuberculosis patients to the Department of Tuberculosis, Government of Goa. Either they can do it by physical forms, or there's an app available, Nisha app, they can upload the documents. Even the patients get benefit from the government. Once registered with the Aadhaar card, there are subsidies given to the patient where the medicines can be given free of cost, where there's some amount of monetary benefit is also given to the patient for finishing the course of tuberculosis treatment. This is thing started by Government of India with the intention of eradication of tuberculosis by 2025.
Right. So, doctor, do you think it is curable? Is TB curable, and what is the adherence to the treatment?
Yes, TB is curable. Very important here is patient should be monitored. Very important is the patient should be counseled. Patient should be told to finish the full course of treatment. Normal treatment is 4 drugs in the first 2 months. That's a intensive phase, followed by continuation phase, which we give the 3 compounds after 2 months for another 4 months. So total of 6 months treatment is being given. Here the patient, what happens when you start the patient on treatment, it's usually by 3 weeks to 4 weeks patient starts feeling better, the cough comes down, the fever starts reducing, he starts gaining weight, there is a sense of well-being, and that is the time when he stops the treatment. It has to be told to the patient that please do not discontinue the medications at the 3 or 4 weeks, continue the medications throughout the course of 6 months. 70% of the germs are killed within the period of 6 to 8 weeks.
Okay.
So it's addressed 4 months, which is the continuation phase, which is very important.
Right. Doctor, we have a call. We'll take that call. Hello?
Hello,
Yes?
hello.
हॅलो हय आयकपाक येता विचार
म्हाका माझे हांगा लंग्स प्रॉब्लेम आहा.
ओके
म्हाका न्हिदोंक म्हाका खोकली मारता.
ओके
म्हाका एलर्जी जाता. ते वास येयलो म्हाका खोकली मारता. हे म्हजे आणि हांव न्हू प्रॉब्लेम पडटाले मेडिसीन करताले. पण आता म्हणजे मेडिसीन ना.
तर मेडिसिन्स किती बंद केलं तुम्ही? होय, दमेचे आसा तुका यू हॅव टू टेक मेडिसिन्स लाईफ लॉंग. हे तुझे मेडिसिन्स आर डॉक्टर, मेडिसिन्स आर लायक युअर बुलेट प्रूफ जॅकेट. ते तुझे कवच आसा. ते तुम्ही पळयला ते सोल्जर वॉरन वयता ते बुलेट प्रूफ जॅकेट घालता, कवच घालता. तेका कवच काडटलो, तेका बुलेट लागतले, ते मरतलो. तो कवच आसा ते बुलेट लागतले काय जावचें ना. ते इनेलर तुजे कवच आसा. ते दोतोरान तुमकां मेडिसिन दिला, ते इनेलर दिला, ते तुमकां सदां घेवपा जाय तुमकां.
पण म्हाका थोडे लागले मेडिसीन खाली नाक म्हणला. पण म्हाका जिगला डॉक्टर
कितें जाता?
एलर्जी घेतली म्हणजे कसला वास येयलो भायल्यान कितें.
होय, तुका होय
घेता.
होय, तर तुका इनेलर आनी नेझल स्प्रे तुका घेवचे पडटले. तुका नाकाचे स्प्रे येता, एंटी एलर्जीक स्प्रे येता, तो तुका घेवचे पडटले. तुका तुमचे दोतोरान तुमकां इनेलर.
हॅलो.
येस मॅम.
200 ते पंपिंग घेताले बट आय स्टॉप इट.
कितें बंद केला तो? ते बरें आसा तो. व्हेरी गुड इनेलर.
सदां कंटिन्यू करनाक म्हणटा डॉक्टर.
ना तुका दमेचे आसा तुमकां करचें पडटलें. कोण दोतोर अशें सांगपाचें ना. ना 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 तुमकां इनेलर तुमकां घेवचें पडटलें. तुमकां ते तुमी बिडोकॉड इनेलर घेता ते बरें आसा. 200चे मायक्रोग्रामाचे दिसान 2दा, सकाळी एकदा, सांजचे एकदा तुमकां रेग्युलरली घेवचें पडटलें तुमकां. ओके, रेग्युलरली घेवपा जाय तुमकां. हां,
ओके, थँक्यू डॉक्टर.
टेक केअर.
ओके थँक्यू. इश्टांनो, घेऊया एक ल्हानसो विसो. पळयत रावा प्रुडंट.
हांव दोतोर धनेश वळवयकर, एलर्जी ह्या विशयाचो तज्ञ, आनी हांव तुमचे समोर आसतलो शुक्रारा 8 जुलैक सांजेच्या 6 ते 7 वरांचेर प्रुडंटच्या हॅलो दोतोर ह्या कार्यावळीन. आनी त्या दिसा तुमी म्हाका एलर्जी बद्दल सगळे प्रश्न विचारपाक शकता, ल्हान भुरग्यां पासून व्हडल्या पर्यंत. ल्हान भुरग्याक जावपाची फाशनां परती परती विजींग, व्हडल्यांचो आस्थमा, नाकाची एलर्जी, परती परती नाक गळची ब्लॉक आसचे हेची, कातीची एलर्जी, खाज येता परती परती ती, किंवा फूड एलर्जी किंवा आनी कसली एलर्जी मेडिसिनाची किंवा कसली एलर्जी आसता ती, तुमच्या सगळ्यांची उत्तरां त्या दिसा मेळटली. 8 तारखेक जुलैच्या शुक्रारा 6 ते 7 वरांचेर प्रुडंट मिडियाचेर हॅलो दोतोर कार्यावळ.
इश्टानो परत एकदा येवकार आयच्या हॅलो दोतोराच्या कार्यावळीन. म्हज्या सांगाताक आसा डॉक्टर अनिल मेंढीरत्ता, वास्कोचो फामाद तज्ञ दोतोर, तो चेस्ट फिजिशियन म्हणजे पुलोमाचो दोतोर. आनी तुमचे जे कितें प्रश्न आसा ते तुमी आमकां विचारूं शकता. आमचो फोन इन प्रोग्राम आसा, लायव्ह आसा आमी. आमचो फोन नंबर जावन आसा 24904444 आनी 24904445. त्या भायर आमी लायव्ह आसा सोशल मिडियाचेर, यूट्यूब आनी फेसबुकाचेर. थंय तुमी आमकां तुमचे प्रश्न विचारूं शकता. तो दोतोर, आयच्या कार्यावळीन परत एकदा तुका येवकार.
थँक्यू.
वी वर टॉकिंग अबाउट TB and the adherence to the TB treatment. If the TB treatment is abundant, is there a chance of recurrence, or will the disease entirely be not cured? What is the scene?
No, if the very important, the person has to finish the 6 months of the treatment. If the person doesn't finish the 6 months of the treatment or gives up the treatment in the middle, there is a very high chances that he might develop something called a resistant TB, where he is resistant to the first line of the medicines. And it's not only that resistant to the first line of medicines. Normally the first line of treatment is 6 months, where the medicines are not so very toxic, don't have much side effects. But if he doesn't take it properly, he becomes resistant to any of the first line. The treatment increases to 18 to 24 months with severe side effects. And not only that, he spreads the disease, the resistant TB, to the society also. So it's not only going to harm him, but there's going to be spread of the resistant tuberculosis to the society. So we do have some responsibility towards the society, where we have to motivate the patient to take his first line of medicines properly and finish the full course. Government actually has got this tuberculosis workers or moderators, where they go to people's house, they talk to them and request them to finish the course properly and observe that.
They see that they are not
they
in the
see to
treatment.
that they've taken the course regularly.
Right.
So now actually it's called as DOTS, directly observed therapy short course, where the
Yes.
patient is observed that he finishes the short course of treatment fully, so that we can prevent resistant coming up, so that resistant TB is reduced.
Right. So doctor, that was TB. It was one of the actually major diseases that we had in India. But now I think it has been taken over by the COVID-19 pandemic.
Yes.
And we've seen the first wave, the second wave, the third wave. So there is, they say, the fourth wave. Is it really happening? Is the fourth wave of
According
COVID
to me,
happening?
I think so is happening. We are getting 180 cases yesterday, 200 cases day before yesterday.
Right.
So it's been over 100 for last 10 days, at least in Goa. And even in India also, we are getting around 13,000-14,000 in a daily. The new cases I'm talking about. Only advantage is that this Omicron B.4 and B.5, which is there right now, is the commonest strain. Is till now is a very weak strain. Is just causing much of an upper respiratory tract infections. Very few people with lung involvement is there. So that's a very good sign. In fact, right now, I hope it is not the fourth wave. I hope I'm wrong. I hope it is just an endemic situation where the disease is localized and we die off in near future. Where the germs just die off in the near future.
Right.
So hopefully it might become endemic in near future.
Right. Like you said that the strain has been weakened now. Do you think it's because of the vaccinations and the vigorous pursuing that we have done to vaccinate every individual? Do you think that is the role that has been played?
Very high possibility the vaccination has helped, where people who are vaccinated with both the doses also are getting COVID infection, but they are of milder form. So what happens is that basically the virus which goes inside the body produces an immune response. So immune response in this kind of patient, where the person already vaccinated, is much better. So the person gets a less severe disease. So disease is basically localized to upper respiratory tract. And other thing is that the virus itself has become weakened over a period of time. We don't know when it might worsen, like the way Delta came into picture. But if it turns and if it mutates, then we might have a real severe wave later on. But most important thing, whether virus is weakened or it's going to worsen, we can reduce the spread of the disease by following COVID appropriate behavior. Very important is that
Right.
wear a mask. If not vaccinated, get yourself vaccinated. Luckily, Goa has got 100% coverage of vaccination of both the doses.
Right. There was a little reluctance with the booster dose. There were few people who have taken, few people are still reluctant in taking. What are your thoughts and your advice to the patients to take the booster dose?
Actually, in India, that's not the booster dose, it's the precautionary dose.
Right.
So, it's been whatever vaccine which you have taken earlier, we need to take the same. So, basically, it has been, many people have taken it, many people are taking it also. It is not real, the actual science says that you need to take the precautionary dose or the booster dose within 6 months of the second dose. So most of us have taken the first and the second dose almost in a year and 3 months back. I took my second dose in month of February 2021, so which is almost 15-16 months apart. So taking that vaccine, how much is going to boost my immune response, I really don't know. But yes, there's no harm in taking it. It's a very, very safe vaccine. We can always take it. And now one of the messenger RNA, till now we have the live virus vaccines or partly killed vaccines available in the market. One of the messenger RNA vaccines made by a Pune-based company, our own Indian company, has got an approval. So it should be coming into the market very soon.
Right.
Till now only Pfizer, Moderna and Johnson were making it abroad. So we are going to get it. And very important, that vaccine, the problem with messenger RNA vaccine is the temperature. You need sub-zero temperature. This particular messenger RNA vaccine made by the Pune-based company is thermostable.
Okay.
You can
It
store
doesn't
it in
need to
the
be kept
fridge.
at a particular
You can store it in the fridge. You don't need sub-zero temperature to store it. So
Right.
that's going to be one biggest advantage in India, to transport it and maintain the cold chain.
Right. Doctor, what are the most common post-COVID complications that you have seen in your practice during the pandemic?
Second wave was very bad. Many patients were on ventilator, many patients were on prolonged oxygen therapy. Most of these patients who were on prolonged oxygen therapy, long-term steroids, on ventilator, has developed lung fibrosis.
Right.
But the good thing about the lung fibrosis is that most of these patients, when we put the patients on anti-fibrotic medicines which are available, 2 of them are available in India, they have responded to it. Most of them have recovered, the fibrosis have been reduced drastically. They don't require oxygen at home now. They were dependent upon oxygen 16 to 18 hours a day. Most of them have recovered. There are very few of them which are still on those antifibrotics, but they are much, much better. The third wave didn't usually cause much of the lung problem, but most of these patients are mentally, morally down. We need to boost up their morale. They come with vague symptoms. I'm not getting sleep, I'm getting palpitations, and there's loss of appetite, etc. They are basically, you need to counsel these kind of patients to boost up their morale.
Right. Doctor, besides the COVID vaccine, is there any other vaccine that is there for respiratory diseases? I mean, of course, the children have pneumonia vaccine that's given to them, but what is the other vaccines that are available for adults and children as well?
Yes, COVID has made one thing very much aware to the people, is the adult vaccinations.
Right.
This adult vaccinations was, available in Western countries earlier.
Yeah.
It is also available in India also, but they were
nobody
very
used to take
particular
them.
about it.
Yeah.
No one was using it. There are basically 2 types of vaccines which need to be given to an adult. One is the pneumococcal vaccine, and the second one is the influenza vaccine.
Right.
Influenza vaccine is a viral vaccine, so you need to keep on giving once in 11 months when the strain changes. Pneumococcal vaccine is the bacterial vaccines. Basically, there are 2 types: the conjugate vaccine and polysaccharide vaccine. The conjugate pneumococcal vaccine is given first dose, and to be once in a lifetime is enough for it. The second one is polysaccharide vaccine, which we give after 1 month and to be repeated every 5 years.
Okay.
So these 2 vaccines are to be taken specially for people who have got, like fibrosis of the lung, patient who have recovered from tuberculosis, patient who have asthma, chronic bronchitis, patient who have a heart failure problem, patients on chronic kidney disease, patient on chemotherapy, HIV patients.
Who are immunocompromised.
Yeah, immunocompromised patient. It really helps them to prevent getting secondary infection.
Right. And doctor, is there a flu vaccine or the flu shot that is commonly
Yes.
said in the Western countries? Is it the same thing or is it something
Yeah, the
different?
influenza vaccine is the flu shot,
Okay.
to be given once in 11 months. Many of the companies and even certain airlines insists that all their staff should take
Should
this
be
flu jab.
vaccinated.
They call it
Right.
flu jab or influenza vaccine.
Right.
Once in 11 months, they need to take it. Otherwise, they are not even allowed to come back to work.
Mm-hmm.
In order to reduce the sickness, in order to reduce them taking sick leave, and in order to reduce causing pneumonias in their lung. The influenza pneumonia is very common in United States. One of the biggest causes of mortality in US is the influenza pneumonia. So they are trying to reduce it by making
By
it
giving flu
compulsory
shots.
to take the flu jab once in a year.
Right. Doctor, in respiratory diseases, what is COPD? What does COPD mean and what does it cover?
Yeah, COPD or COLD or COAD, chronic obstructive pulmonary disease or chronic obstructive airway disease or chronic obstructive lung disease are one and the same things.
Okay.
This is, you need to differentiate from asthma. Asthma can also lead to COPD in the long term. You know, what happens in asthma is reversible. Like I told you earlier, this obstruction can go back to normal with medications here. This part. While in COPD, it doesn't go back to normal. There's a fixed obstruction over there. COPD is usually seen in elderlies, about 45-50, patients with a history of chronic smoking, patients with occupational dust exposure. With the pollution, these people get COPD. This patient usually become breathless. They may need oxygen at home. The treatment is different. We don't usually put the patients on steroids here. We put the patients on some other inhalers. They are called as anticholinergic inhalers, which are muscarine receptor inhalers, which are to be taken the same way, but treatment differs here. So giving steroids to them is only when the patient gets exacerbations or with the cover of antibiotic. If you put the patient on a steroid inhaler, these patients are much more prone for infections. So steroids basically are to be avoided in these kind of patients.
Right. Doctor, we have a question on social media. It says, is it normal to sneeze 3 times every day after waking up? It has become more of a routine.
No, it's not normal to sneeze 3 times after waking up. Why should someone sneeze 3 times?
Or for that matter, even more than 3 times.
Even one also in 4 times is not a normal. That's what, there must be something on his bed, something on his
In
in
the
his room which he must be inhaling, or something might be even the windows open, the pollens are on the side. Something should be there. We should find out the cause, and if he's getting it, we need to stop that sneezing. Maybe take it to the nasal spray in the night before going to bed, so that he doesn't get a sneeze in the morning.
Right. Doctor, we have another question. Does food allergies lead to asthma?
Yes, food allergy also can lead to asthma, definitely.
And what is the treatment for it?
If it's asthma, then
It's
again
the same.
inhalers are find out the source of allergy. If you think that this particular food is causing you a problem, then one needs to avoid that food. There's no other way. I don't like you, you don't like me, we fight with each other till we keep away from each other. There's no fight. So if you think that particular food is causing you a problem, please be away from that food. Very common thing which in food allergy, which is many people are allergic to, is Ajinomoto, which is found in most of the Chinese food. I'm not anti-China or something. What I'm saying that many people, especially the chips, kurkure, Maggi, Manchurians, they have Ajinomoto in them.
Ajinomoto,
Many
which is
people are
added.
allergic to that.
Right.
Basically, we need to avoid junk food. Go back to natural. The junk food contains a lot of preservatives. Avoid preservatives. Try to go natural. The more natural you go, less chances of getting all these complications.
Right. So, Doctor, COPD is mostly seen in elderly age group. In the younger age group, is there any congenital diseases that could affect the lungs?
Yes, especially the condition like cystic fibrosis, which is not routinely seen. Cystic fibrosis is seen in 1 in a million case over here in India. At least I have not seen any case of cystic fibrosis as of now till now. It's one of the very rare diseases. Other diseases like collagen vascular disorders, etc. They are the diseases which are prevalent here. Other thing which can happen during childhood is viral infections of the lung, viral bronchitis, viral pneumonias. This itself can cause some kind of problem later on in their life.
Right. So, Doctor, now with the COVID pandemic slowly dying off, there have been reports of a new disease that is coming up, that is monkeypox. What are your thoughts on that?
Monkeypox is there. The first case of monkeypox was detected somewhere in 1958. Why it's called monkeypox? Because this monkeypox was seen in laboratory animals in the monkeys first in 1958, and then they were labeled as monkeypox. The first case was found in 1970 in Democratic Republic of Congo. It is endemic in Central and West Africa. It was always there. But it was not to that extent which was there, basically because at that time the smallpox was very prevalent. The last case of smallpox was seen in 77 and it got eradicated in 1980. It belongs to the same group of viruses. So people who have taken the smallpox vaccine during, like I have taken the smallpox vaccine, people must be having a big scar on their arm. So that vaccine is supposed to prevent or protect you against monkeypox also. What happens in monkeypox? It was very few cases earlier, localized only to Central and West Africa. Now almost 30 odd countries with the cases going up to almost 600-700 all over the world. WHO is really getting panic now because of the wide spread of this virus. What actually happens is people usually come with fever, headache, body ache, muscle pain, and the rash comes initially after 5 to 7 days, and then the blisters comes and big lymph node comes, big glands come. So since the person is very prone for infection, septicemia, that's maybe there. There are very few deaths reported as of now. Why we should be worried about it? Because it's highly contagious. It can spread by air droplets. It also can spread by touch. So the precautions remain the same. That is the COVID appropriate behavior precautions, wearing a mask and maintaining the hand hygiene. As of now, no cases of monkeypox are seen in India. Till now,
I hope they're not seen.
I hope we don't see any also in future.
Right. Doctor, we have a question on social media. It says, do you think that wearing mask also prevents fungal diseases or it only prevents viral?
No, see, wearing mask prevents all kind of diseases. In fact, it protects you from the pollution also. It's not viruses, bacterial, fungus, any kind of things, it protects you. It's basically a barrier which has come up over there. Only thing, you're wearing a mask, see to that if you're wearing a cloth mask, you wash your cloth mask daily, wear a fresh one daily. If you're wearing a 3-ply mask, dispose it off. If you're wearing N95, buy 4 or 5 N95s, use one today, the second one, third one, fourth one, fifth one, and repeat on the 6th day the first one again. Keep on rotating for 5 to 6 cycles rather than wearing the same one daily.
Right.
Other thing which you got to see to that is the mask should not get wet. A wet mask is worse than not wearing a mask. So do not wear a wet mask at all.
At all, yeah. But doctor, now we are in the 4th wave, or supposedly, I'll say in the 4th wave of COVID. Do you still think that we need to, besides the healthcare professionals, do the normal public need to wear N95? Because besides preventing COVID, we should also think about the pollution that we are causing using masks. So what are your thoughts on that?
No, plain cloth mask is good enough. If both the parties are wearing a mask, it's as simple as that. If myself and you are wearing a mask and we are close to each other, chances of we getting infection from each other is just 0.5%.
Right.
So plain cloth mask is good enough. I still feel that N95 should be limited to healthcare workers.
Professionals.
Yeah.
Right. Doctor, we have another question on social media. It says, can asthma be cured completely?
No, asthma cannot be cured. Asthma can be controlled. You can be as fit as anyone else provided you take your inhalers properly. One should take the inhalers and go back to his normal activity as early as possible. Inhalers, I'll repeat again, have got no side effects and you can be perfectly fit person. There are a lot of asthmatics in the world who are playing sports. They're winning gold medals in Olympics. I'll give one example, Jackie Joyner-Kersee. She has won gold medal in Olympics. There are a lot of film stars who are making money on advertisements of asthma. They themselves they're very well fit on inhalers. I request you people who are asthmatics to please stick to your inhalers, take it regularly, provided the technique is taught to you properly.
So I think asthma is no more a stigma like it was in the olden days. I think it's now very curable and controllable disease. Right, doctor?
Yes.
So as we go towards the end of this program, what were your thoughts and what is your message to the public of Goa?
My message to public of Goa, we are most supposedly into a 4th wave. People have forgotten to wear a mask. I'll tell people, please follow COVID appropriate behavior. Please wear a mask. I know Goa is 100% vaccinated, but still, you may not get a severe disease, but there are elderlies, there are people with other comorbid conditions who might get the infection. The infection might cause a serious harm or death to that person. So considering those elderly people and people with comorbid condition, is advisable that please wear a mask. And if not vaccinated, please get yourself vaccinated.
Right. Doctor, I have one question and I think I have to ask it. Is there a chance that asthma will be totally terminated like smallpox in the near future?
No, asthma cannot be terminated like smallpox.
Because it's
Yes, we need to control it, prevent it from worsening, minimize the use of oral tablets or injectable any injections by sticking to inhalers. It's a totally a controllable disease. There might be small increase in the symptoms, small exacerbations might be there, but we can totally control it by taking the inhalers.
right. Dr. Anil, thank you so much for taking your valuable time out from your busy practice and spending time with us at the studio and taking all our questions and sharing so much knowledge about asthma and various respiratory diseases. इश्टानो मेळुया फुडल्या शुक्राराक म्हज्या वांगडा आनी एक तज्ञ दोतोर आसतलो डॉक्टर धनेश वळवयकर. तयार रावा तुमचे प्रश्न घेवन. तो म्हणसर पळयत आहात प्रुडंट. काळजी घेयात आनी मोग आसूं.
हांव दोतोर धनेश वळवयकर, एलर्जी ह्या विशयाचो तज्ञ, आनी हांव तुमचे समोर आसतलो शुक्रारा 8 जुलैक सांजेच्या 6 ते 7 वरांचेर प्रुडंटच्या हॅलो दोतोर ह्या कार्यावळीन. आनी त्या दिसा तुमी म्हाका एलर्जी बद्दल सगळे प्रश्न विचारपाक शकता, ल्हान भुरग्यां पासून व्हडल्या पर्यंत. ल्हान भुरग्यांक जावपाची फाशनां, परती परती विजींग, व्हडल्यांचो आस्थमा, नाकाची एलर्जी, परती परती नाक गळची ब्लॉक आसचे हेची, कातीची एलर्जी, खाज येता परती परती ती, किंवा फूड एलर्जी किंवा आनी कसली एलर्जी, मेडिसिनाची किंवा कसली एलर्जी आसता ती, तुमच्या सगळ्यांची उत्तरां त्या दिसा मेळटली. 8 तारखेक जुलैच्या शुक्रारा 6 ते 7 वरांचेर प्रुडंट मिडियाचेर हॅलो दोतोर कार्यावळ.
तुम्ही पळयतात प्रुडंट.